Okay, I'm going to get us started now. Good morning, good afternoon, and good evening to everyone joining us today. Thank you so much for taking the time to be with us for this important conversation, protecting global health investments, advocacy strategies in a changing budget landscape. My name's Eliana Monteforte, and I'm pleased to welcome you on behalf of the Global Health Council and the Global Health Advocacy Incubator. Before we get started, I want to cover a few housekeeping items. So please note that this webinar is being recorded, and the recording with the presentations and any key resources will be shared with all registrants after the session. And Global Health Council also posts the recordings on our Global Health Council YouTube channel. So you'll be able to access it there, and feel free to disseminate with anybody within your networks that might be interested in hearing our conversation today. Second, we strongly encourage this to be an interactive discussion, so please feel free to submit questions at any point in the webinar using the Q&A box. We'll be monitoring those questions and we'll bring them into the discussion, but just to note that if you put a question in the chat, we may miss it, so please be sure to use the Q&A function. The chat, however, is a good space for you to introduce yourself, to share where you're joining from, and to engage with fellow participants, as well as our panelists throughout the session. So feel free to go ahead and introduce yourself. So now turning to today's discussion, across low and middle income countries, domestic health budgets remain the largest and most sustainable source of financing for essential health services. So from infectious disease programs to maternal and child health, nutrition, pandemic preparedness, and broader health system strengthening. Yet in many of these settings, health spending continues to fall short of national commitments, and especially population needs. At the same time, we're navigating a rapidly shifting global funding landscape. Reductions in U.S. global health assistance alongside changes in development assistance from other major donors are creating new uncertainty for countries that have long relied on external financing. So this moment presents both a challenge and a turning point. As external funding becomes less predictable, the importance of domestic resource mobilization and the role of civil society in advocating for it has never been more critical. And that's exactly what we're going to be talking about today, and why this conversation matters so much. So this webinar is designed to first provide a clear picture of the current global health budget landscape, highlight why sustained investments in health are essential for both health outcomes and economic resilience, and to equip advocates and partners with practical tools to engage policymakers effectively. We'll also hear directly from country level leaders who are advancing this work in real time, sharing both their successes, some of the resources that they've used, and also challenges that they have been facing. So I'm going to start by introducing our excellent group of speakers. We're pleased to be joined by Veena Menon, Associate Director of Health Policy and Financing at the Global Health Advocacy Incubator. Veena leads a multi-country public financing advocacy portfolio focused on strengthening domestic health financing and improving budget formulation, execution, and accountability. She brings extensive experience supporting federal health programs and global health partners, and holds a master's degree from Columbia University School of International and Public Affairs. Veena will also be facilitating a discussion with the following distinguished panelists. We have Stephen Atasige. He is the in-country coordinator for the Prevent Epidemics program in Ghana. He brings deep experience across national and international institutions, including the Ghana Health Service, the US CDC, WHO, and others. Stephen has played a key technical role in response to Ebola, COVID-19 across multiple countries, and has a strong background in epidemiology, health security, and domestic resource mobilization for health. We're also joined by Son Pen, Executive Director of the Coalition for Partnership and Democratic Development in Cambodia. With over 15 years of experience, Son has been a leading voice in advancing democratic accountability, budget transparency, and citizen engagement in public finance and local governance, particularly in strengthening civil society's role in public financial management. And finally, we're honored to have Dr. Aminu Magashi Garba, founder and CEO of the Africa Health Budget Network. With more than 30 years of experience in development work, Dr. Garba has been a pioneer in using budget advocacy to drive more transparent, accountable, and effective health financing across Africa. He's played a leading role at both national and global levels, including the PMNCH, the Global Financing Facility, and the Global Health Security Agenda Consortium, and has led numerous initiatives to strengthen accountability for health investments. We're incredibly fortunate to have this group of knowledgeable and experienced speakers. And with that, I'm going to now hand it over to Vina to kick us off with an overview of the health budget, advocacy, and the current landscape. And Vina, give me 1 second to just share my screen. That should work. Over to you, Vina.
Thank you so much, Eliana, and thank you to GHC for hosting this and for the partnership. As Eliana mentioned, I'm with the Global Health Advocacy Incubator, where I lead our CSO Budget Advocacy Accelerator Program. GHAI's model for CSO advocacy orients CSO, civil society organizations, who are our primary partners, toward their own governments, toward finance ministries, budget committees, planning commissions, and toward the officials who decide how domestic revenues get allocated to health. And we've organized our approach around 3 pillars. Pillar 1 being political will and demand. As we all know, political will is about more than good arguments. It comes from coalitions, from health workers, parliamentarians, journalists, community leaders, all showing up with a consistent ask. It comes from a public demand and comes from making lawmakers and policymakers feel that not allocating funding is the riskier political move. Building that coalition and sustaining it across a budget cycle, that's the first pillar. The second one is budget process and entry points. Budget cycles are predictable. They have phases, and each phase has specific entry points where advocacy can land. If you know when the budget call circular goes out, when draft estimates are due to the finance ministry, when the legislature reviews these asks, you can time it, and you can get your evidence in the right hands at the right moment. If you miss these windows, you're essentially engaging in advocacy into a process that's already closed, and so we'll be waiting another year. So this is about treating the budget calendar like the advocacy calendar. The third pillar, we're all familiar with this one, disbursement and accountability. Getting a budget line created or a funding level increased is not the finish line. It's actually more like the halfway point, as those of us who worked are aware in this field. The real question is, did the money actually get released? Did it flow from the Ministry of Finance to the implementing agency? Did it reach the intended audience and program? Did it get spent on what it was supposed to be spent on? We've seen situations where governments make a public commitment to health security funding, and a year later, perhaps the money is still sitting unspent because no one tracked whether it was dispersed. CSOs have a very critical role to play in this accountability function, and both Stephen and Penn, whose work I'm familiar with, are going to bring each of these pillars to life with real examples. Let me first show you a look at our framework and the tools that we used. Eliana, if you could move to slide 5. Thank you. So GHAI cycle, we've essentially translated these 3 pillars into a 4-step cycle that guides CSOs from the very beginning of a campaign through long-term sustainability. The first step is campaign planning, where landscape analysis is very important, identifying who are the decision makers, what the budget process actually looks like at the country or at the level of government, what laws exist that support your ask, and what is the funding gap. This is where there's a temptation to skip ahead straight to the meeting with the minister. But with the stakeholder mapping, CSOs know whether the policymaker is an ally, a fence sitter, or someone you need to work around. The second step is campaign implementation. This is where we build our coalition. We engage with policymakers directly with evidence and specific asks at the right moments, run a media advocacy campaign to create public pressure and amplify the issue. The third one is budget accountability. Once a commitment is secured, you track it. Was the money allocated? Was it dispersed? Did it reach the right agencies and programs? This is where parliamentary champions become essential. because a CSO cannot often compel agencies to disperse funds, but a parliamentarian who's been briefed on the issue can. And step 4 is budget sustainability. Finally, you use what you've learned to build the case for the next budget cycle. What worked, what didn't, where are the new entry points? Are there new revenue sources like health taxes or earmarked levies that could create a more sustainable funding stream? It's important to note that this cycle is not linear. In practice, you're often doing coalition building and accountability work at the same time. Moving on to the next slide. In this one, we'll give you a quick look inside the budget advocacy toolkit that GHAI has developed. All of it is very practical, and there are 6 components. Some of it is a repeat of what you've already heard previously. I want to leave time for our country conversation. So the landscape analysis, we've identified sort of the country context, the disease burden, what the implementation looks like, the political and stakeholder mapping. Who are the decision makers? Where do they sit in the budget process? Who's likely to push back and why? The budget process mapping, where every country has a budget calendar with very predictable phases. And this tool helps you map those phases and identify the specific moments where advocacy can land. Legal analysis focuses on what laws and frameworks exist that support your ask. Are there gaps or inconsistencies that you can use? And this is especially important for things like tobacco control work, where you often have laws on paper that aren't necessarily funded. Coalition building and communications, worksheets for profiling potential coalition members, planning stakeholder outreach, and designing media campaigns. Who do you need in the room, and what does each of them need to hear? And finally, budget tracking and sustainability, a framework for tracking indicators. What was committed, what was allocated, what was dispersed, and what was spent. This is your accountability infrastructure. I want to say the toolkit is publicly available on our website, so please feel free to log in there. I'll make sure that the link is in the chat after I'm done here, and you can download all of the worksheets. Moving on to slide 7, this is just to give you a quick sense of some of the work that GHAI has done and work that's ongoing. Just a few examples. Again, I'll try to walk through them really quickly. Through our CSO Accelerator program, the one that we all work on, our Ethiopian CSO partner MWF has been successful in instituting the first ever dedicated tobacco control budget allocation in Addis Ababa from the City Finance Bureau. And in Bangladesh, our CSO partner Sarak has been working to get a proven youth mental health model formally recognized and financed across 1,200 national health centers. This against a very difficult backdrop. Basically, there's been a government transition earlier this year, for those of you that have been following it. And obviously, when you have a mid-project reshuffle like that, all of the key contacts get muddled. So that's been quite a Herculean task. In Uganda and Nigeria, GHAI's previous CSO Academy cohort in Uganda particularly secured approximately 15.4 million USD for epidemic preparedness, essentially bolstering this country's health security efforts in the 2024-25 fiscal year. And in Nigeria, the budget for the Nigeria Center for Disease Control increased to more than double to a record 2.9 billion naira. Both came from very sustained CSO-led advocacy, targeting finance and health ministries, building parliamentary champions, and showing up at every stage of the budget cycle. Bangladesh and Nigeria, our NCD work there has the same approach. They work across very different financing mechanisms. In Bangladesh, advocacy contributed to the passage of a health development surcharge on tobacco products, making Bangladesh the first country in South Asia to earmark 100% of those revenues to NCDs, non-communicable diseases. And in Nigeria, thanks to coalition advocacy, there was a 200% increase in the budget for non-communicable diseases in 2025-26. And finally, we'll hear more from CPDD through GHAI's Data for Health program. Our CSO partner in Cambodia, CPDD, Son Pen is here representing them, secured a 422% increase in CRVS budget allocation at the subnational level in the Siem Reap province. This is through decentralized commune-level advocacy. Civil registration sounds very administrative. Son Pen is going to show us that it's fundamentally a financing and governance challenge, and that the same budget advocacy tools apply. So with that, I'll conclude my presentation. We'll move to from tools to practice, which is essentially country conversation. As we all know, all of these tools only matter if they work in real budget cycles with real governments and real political resistance. So I want to bring in three colleagues who can speak to that from the ground. Eliana has already introduced them. We have Aminu from the Africa Health Budget Network, Stephen from GHAI, and Son Pen from CPDD in Cambodia. Welcome. So I'll start with a question for all three panelists. When you walk into a meeting with a government official who doesn't see health financing as their problem, a finance ministry official whose priority is fiscal discipline, not health outcomes, what's your opening? What do you say first? Aminu, should we start with you?
Okay, thank you very much for this question, and greetings to all the participants. I'm calling in from Abuja, Nigeria, and this is a very interesting question and also very relevant to the Nigerian context, where we are in a pre-election year right now in Nigeria. The government has so many priorities, not only health, but the issue of security, issue of defense, and issue of infrastructure development. So when me as an advocate, I am confronted with engaging with the Minister of Finance and trying to convince the Minister of Finance to put health on the agenda also. One of the key entry points we always use is that even though we prioritize security and defense because of challenges, we also need to see health as also part of the national security agenda. Because without healthy people and healthy nation, even the security can be compromised. So we put health not just as a recipient of a budget, but also health as an investment to development and to also socio-cultural and so many other critical issues in the country to be addressed. So this is how some of the entry point we use to really, put a very strong argument that the health should be prioritized at every level, in every discussion, and also at every fora with the finance stakeholders, with the parliamentarians that we are engaging regularly, and also with the other political stakeholders. So this is how we approach the health. It should not be just a recipient or a beneficiary. It's an investment to a national security agenda, to a population agenda, and to also development agenda in the country. Thank you, and over.
Thanks, Aminu. I'm looking at Pen. Pen, do you want to take a crack at this question?
Yeah, sure. Very, very hard question. Actually, this is also a practical question that very much reflect with our works so far. We even worse when we talk to the finance officer, but even worse than finance officer, which is the treasury, because the treasury is more restrict on the expenditure procedural and accounting procedure and so on and so forth. So that's why from our experience, we sometimes not really go straight to the health argument, right? The budget for health argument, but we start with how you make sure the budget is more efficiency plannings and also return on investment. Why we discuss on return on investment instead of the health arguments with the finance officer, especially with when we work very close with the Ministry of Finance, especially the General Department of National Treasury. When we talk that this can be helped for the health human or something, then it's not really use their language. So that's why we start somehow related to how you make sure your budget efficiency without any accurate population data for budgeting, right? Because when you starting this, then they really realize that the data is really benefit for budgetings and another side related to the plannings. So we are seeing that how you plan your service without any kind of clear population and so on and so forth. So that's why we start to try to play around by using their language and also proving with, and then still the benefit for health program. And then even sometimes when we talk to the Ministry of Finance, sometimes we not really talk that your decision really benefit for civil registration, but your decision to allocate the budget for health, it really benefit for ensuring the data accuracy or accuracy population data for your budgeting or something like that. So that this is way that we try to articulate our process when we talk really critical with the ministry, with the finance officer, especially with the Ministry of Finance, Economic and Finance, and really practical in reflect our work so far as well. Yep, thank you.
Thank you. I'm looking at Stephen now. Anything to add, Stephen?
Yes, so a lot has been said. Yeah, just to add, first of all, budgets, health ministry should view budgets as investments and not just cost, because once you increase budgets for health, you are ensuring that populations are healthy, which has a reflection on the economy as well, because you are saving people's time to do economic work rather than being in the hospital. And so that's one thing. And also the fact that health is both a social responsibility as well as a legal right, in a sense, of the population, that every human being should have access to good health, and that calls for investments. And so if governments have the responsibility of ensuring that they are offering the people they govern the environment or safe environment to work and bring the best out of them in the economy, they need to invest in health to ensure that they remain healthy, both as a social and of course legal right. And of course to the politicians, of course, and the health ministry, which is always led by politicians, the question they will be asking is, what is in it for them? And as advocates, we try to re-emphasize the fact that once the people appreciate that you have their health in mind and you are investing in it, you definitely win the hearts and the votes of the people in the next election. And that's also a way of convincing policy decision makers like the health ministry to increase their investments in health.
Thanks, Stephen. Did anyone have any questions for the panelists as we move on to other topics? I'm looking at the chat. I don't see any. Eliana, I'll let you flag if we are missing questions from participants.
Absolutely. I will say I do see a hand raised, and we are not taking questions live. So if you do have a question, please make sure that you put it in the question and answer box. It should be at the bottom of your screen. If for some reason you cannot find the box, you can put it in the chat and I'll try my best to track them. But ideally, we would like the questions in the Q&A box. Thank you.
Thanks, Eliana. Once again, a question for all three panelists. All of you have had some degree of success with getting a budget commitment secured. A new line item, a tax commitment, a council allocation. Would you describe for us what accountability looks like on a day-to-day basis? What are the most common places where things break down, perhaps, between commitment and implementation? Who wants to go first? I'm leaving the choice up to you.
Well,
Go ahead, Pen. Go ahead. Go ahead, Stephen, please.
Sure. So budgets are first influenced by policies. And so usually once the policy influences budgets, it's important to ensure that we keep track of the implementation of that policy, and that once the budget is presented, the actual releases in terms of expenditure is really implemented by the Ministry of Finance. And in order to ensure that we need to build champions, usually budget officers who are working within the Ministry of Finance, and also identifying champions within Parliament. Now, these champions within the Ministry of Finance or Parliament are able to ensure that these budgets are actually being implemented. They serve as the contact between CSOs and the institution responsible, because usually it becomes a very closed space where getting information and ensuring that indeed the budget allocations are really being disbursed is not easy to navigate. So building champions within the institutions and also within Parliament, which has the oversight responsibility of ensuring that budgets are executed, is key. And so accountability, first of all, is something we need to look at as one of the key measures of success, because once budgets are presented in figures and you really don't see them through as disbursements, then it comes to nothing. And so for every budget advocacy intervention that we carry out in Ghana, we ensure that we are building these strong advocates or champions within the institutions. And just to add that MPs, even though have an oversight role on budget execution and accountability, there are always competing interests because there are so many sectors, that these MPs have responsibilities to oversee. And so it's important to make a strong case by providing the evidence through either an analysis that you carry out. This analysis helps to inform the MPs and equip them with the figures that would help them ensure that they are holding the Ministry of Finance accountable. If figures do not correspond to the actual budget statements based on the releases, then the MPs will be able to call the ministers, for instance, and then help to ensure that budgets are indeed implemented. And at the ministry level, where technocrats are responsible for ensuring that the budgets that is released from the ministry are also spent, it's important to draw closer to the advocates. As advocates, you draw closer and map out the key entry points where the key technocrats who work within the ministries and responsible for ensuring that monies are spent, that they are writing the vouchers, they are indeed allocating funds to where it is required, and that goes to the accountability aspect, because once funds are allocated to where it's expected to be spent, it goes to show transparency, and it builds the confidence of the Ministry of Finance to even allocate more funding if the agencies or the responsible agencies requires or request for them. But when there is no spending at that level, then you don't give a reason for the Ministry of Finance to increase funding because you are not spending anyway. So we need to ensure that spending is going on and transparently. Thank you, Vina.
Thanks, Stephen. Aminu?
Hello. Okay.
Go ahead.
So thank you very much, and also thanks to our friends from Ghana. Our national and subnational, budget advocacy and accountability in Nigeria, we try to approach the complex, environment of the policy and the political space using a three-pronged approach of advocacy, which is also connected to accountability. There are so many government-led committees and mechanisms, multi-sector and multi-stakeholder in Nigeria, be it in Abuja national level or in the 36 subnational governments. Those mechanisms have been established over a very long time, and they have become useful for the government and the donor partners, professional bodies, and key government officials from the Federal Ministry of Health and other key stakeholders of finance to be having regular conversation on the progress of the health sector regarding allocation, releases, utilization, and also linking the budget utilization to a positive health outcome. So, for example, I'll give you two examples of that. We have what we call Ministerial Oversight Committee of the Basic Healthcare Provision Fund that holds meetings on quarterly basis. One of the prong approach we use to ensure accountability is to promote the civil society sit at the table for all those meetings, not only to comment on what the government does, but to also ensure that the CSO have an agenda item for every meeting to critique what the government is doing, to review allocation and releases of the fund across Nigeria, and also to bring the perspective of the people from the grassroots and people in the street to provide feedback to government. So that is one of the innovative approach we are bringing to the table. And so every meeting, at the end of those stakeholder meeting, we also engage the media to amplify the messages by writing stories, by holding press conference, by developing a budget scorecard that monitor progress, as well as having a direct advocacy visit after holding those meetings. So in summary, these are the three-pronged approach. We sit at the table for all those high-level meetings, engage in direct advocacy visit to parliamentarians and policymakers, and work with the media on day-to-day to amplify the progress made, the challenges to improve budget performance in the country. Thank you, and over.
Thank you, Aminu. You've raised some interesting, I have a few follow-ups, but we'll move to Pen first. Pen, go ahead.
Yeah, sure. Thank you. Thank you all two guys that go ahead first. So it's very good. So in our context, basically, from what we're thinking is the secure budget allocation is just the first step that we have been done. But if we talk about the budget accountability, we need to be make sure that the budget is actual use or not, because if the budget already allocated but it doesn't use or have been not used at the end of the year, so then it doesn't make any benefit to fulfillment the service for the citizen. So that's why in our case so far we work very close with the, especially in our contact and each commune they have the finance assistance at the commune finance assistance. So we work very close to track the expense and also work parallelly process with the provincial treasury as well. Sometimes we request the figure from the provincial treasury to ensure that to monitor the budget spent, whether the budget allocate are spent or not. If not, then what's the main problem that happened. So in our context, what we observe so far is fund not really come on time, especially the delay in fund disbursement, especially because we be more focused on the intergovernmental transfer. So that's why when the late payment, late disbursement, it will be affect to the service delivery as well. And then the second is the limit of the technical capacity at the local level, especially even each commune they have their own finance staff, but they face a lot of challenges with the fund disbursement, especially with the provincial treasury in our context, and also the lack of the gap, the coordination gap between GDI, General Department of the Identification, and also the Subnational Administration Officer. So sometimes the coordination also take a little bit process and also affect to the service delivery and our contact as well. So that's why to address those challenges, CPD brings the three main approach. One is we bring the citizen to monitors by using the online and real-time feedbacks, provide ask citizens to provide a real-time feedback or giving citizen satisfaction on the service, and also the bring the dialogue, create and host the multi-dialogue, multi-stakeholder dialogue at the provincial level to monitor the expense. For instance, we have the provincial dialogues and bring all key stakeholders, provincial treasury, commune officer, district officer, provincial officer, to sit in one room and then discuss what's going on in terms of the expense for the COVS in our context, so on and so forth. So that's why this way that we can bring multi-stakeholder in one room and then reflect each other what the challenge happened and then how we can deal with the challenge. So that's why in the last word, the accountability is not only one-time activity, but the ongoing process, ongoing process that we need to hold the accountability of budget on budget. Thank you.
Thanks, Ben. You've raised an interesting question, and this is one that was triggered when I heard Aminu speak as well. And Pasqueen has raised this question, interestingly enough, in our Q&A here. How do you identify and cultivate real champions within maybe Parliament, within senior offices and agencies who will actively push for budget accountability, who will actively push for you said something very interesting, Son. You said essentially bring everybody together and have sort of even bring in the public so that there's real-time tracking. I think one of the difficulties that a lot of folks run into is availability of real-time data, and just this understanding that you don't find out what's been spent until it's many months or many years later, if you find out at all. How do you identify folks that can help you push the accountability as well as help you assess whether the objectives that were laid out for those particular funds are being met or even being disbursed on time? You raised fund disbursement as a huge, interesting issue, which several countries face. I'll stop right there. I realize there's several questions there, so I'll let you have a go at it, and then maybe we can have Stephen and Aminu jump in. Go ahead.
Basically, in our context, we work also both execution body and also the oversight body. Especially at the subnational level, we have the council body. So that's why we work to ensure that how the council body can monitor the expense and then provide some kind of the capacity building to the council body as well in terms of how you can monitor the expense with the governance bodies. To ensure that the budget have been spent based on the budget that you approve throughout the year. And also sometimes we work closely with the provincial treasury, especially the linkage with the finance management information system, FMIS portal, because in our context we have our FMIS portal that currently implement at the commune, at the district, at the provincial level, and as well as at the central government level as well. So that's why we need to work a little bit closer with the provincial treasury, and then of course we need to build some trust to get the budget figure and expenditure figure is not really easy job for us.
Right.
You need to play a different way and option, formal and informal, especially before we conduct a provincial dialogue or some kind of the capacity building through the council body. We need to have some kind of the informal engagement and also the pre-engagement with provincial treasury and also Ministry of Finance and as well as Ministry of Interior, how those main body work close to each other at the central level, and also how we can bring this power to influence at the local level, especially at the commune level. So that's why we flow out through the citizen monitoring and also the dialogue mechanism or platform that we can bring everyone in and then monitors the process. And at that time, sometimes we invite one event that we conduct in Siem Reap, we invite provincial treasury to present the budget data and also the expenditure up to date, and then they can discuss each other what the challenge and then what the best practice that they can meet with they can spend based on their plan as well. So I think in our work in the budget is not really not really easy work, right? So we need to play a different option and different entry point, especially with Ministry of Finance. We need to work very close.
Yeah.
Not only focus on the Ministry of sectoral ministry. From what we have been experienced so far, sometime our best practice as well. When we work with the line ministry, the selling of the line ministry is that the Ministry of Finance not allow me to use this budget, not approve on this my request budget. But we need to work with both sides. It means that the Ministry of Finance side and also the line ministry side. So this is the way that we play between line ministry and also the Ministry of Finance. So if you only work only one side, then both sides will play around with us. So I think this is also the trick that result from our advocacy so far.
I think Aminu came in with a point. Aminu, are you online? Yes, I see you're unmuted. Go ahead.
Okay. So this is a very interesting question about champions. The question you raised, how do we mobilize champions to support the budget advocacy? What we do on a regular basis is to keep a stakeholder mapping template within the organization and assigning some key staffers within the office to continue to generate information using the media space, attending activities, and also other social gathering and official to continuously update the stakeholder mapping table with the lens of who is interested in the budget issue regarding budget commitment and performance, and also who has the influence. So we try to answer the two questions always at the time when we push somebody as a champion. Does that person has the interest? What is the level of the interest? And does the person has the influence to engage and influence a positive action? And what is the strength of that influence? Now, these are not a static activities and also static category. They are dynamic and they keep changing. One person today could be interested in an issue and tomorrow he's no longer interested. Or he may have influence today and tomorrow he's no longer on the political appointment to actually influence. So we continuously to generate information and we approach champions to really guide them with the information. So any champion we identify in Nigeria, we also empower the champion with a current and factual information regarding the budget category and what that person needs to be done. We share with them a one-pager of advocacy messages or key briefs that they can be used to go to National Assembly and the parliamentarians and make a case, or they can go to Ministry of Finance or Health, or attend the government meetings that I mentioned earlier to put an agenda. So we keep the mapping table, we engage them regularly, we empower them with the information, and we keep reviewing the process of champions, and we find this approach very productive and very useful in our budget advocacy. Thank you very much.
Thanks, Aminu. Stephen, anything to add, or have they done justice?
A lot has been said. That's true. I mean, very good points. So I'll just add that, yes, beyond the assessment of the interest and influence of the stakeholders that you can cultivate as champions, it's also important to employ some negotiation and diplomacy. Usually, it's not enough for someone to have the power or the interest, but there's always, even if they have the interest, there could be some pushback, either because they want to see and again, that question is always important to answer before you do that engagement or cultivate champions. How do you answer the question they may have in mind? That is what is in it for me. That is something we usually encounter when we are trying to cultivate champions, when they ask, some of them may ask those questions directly to you, but then it's something you should anticipate. That is a question they may be asking. And it's important to try as much as possible to align your proposal or your
Mhm.
policy advocacy with the official's own goals as a professional or own goals as a politician. So if someone works, for instance, within the Ministry of Finance as a budget officer, and you are cultivating the person or trying to get the person over as a champion to help you move budgets, the question is, what is in it for the person to be doing that for you as an advocate or a civil society advocate? But then the thing is that when budgets are well executed, it also adds to the credits. It gives, it's credits to the officer. It's you should make the officer appreciate, or the stakeholder, in this case, the stakeholder, whether it's an MP or a technocrat, appreciate that the advocacy is aligned with their goals, first of all, professionally, and also in the interest of the country and the ministry in which they work, to ensure that they are achieving high budgets, success rates or expenditure is well, carried out. And once
Yeah,
budget is successful, it goes a long way to, it goes to the credits of
yeah,
the policy or the stakeholder that you are trying to engage as a champion.
that's right. Thanks, Stephen. I'm looking at the time. We have about, I want to say 14, 13 minutes left. So in the interest of time, there are a few questions that were posed by our participants, as I mentioned earlier. This was one of them. And the next one comes from Martin Coleman. This is interesting. What is your experience engaging youth leaders, both at the community and at professional level, in budget advocacy? And what roles can they play in increasing and sustaining domestic budgeting? If we can keep our answers a little shorter so we can get through more questions in the short time. Whoever
Yeah.
wants to take a first crack at it. I'm looking at Aminu, Song.
All right. Okay, so I can. All right. So
Go ahead, Stephen.
all right. Thank you. In Ghana, when we were implementing the budget advocacy for epidemic preparedness, we used a youth advocate group that was helpful to explore social media as a medium for amplifying our advocacy messages. And of course, the youth, as you agree, is more savvy with the internet and more, comfortable with social media, and are able to are more active there, of course. So they have that time and skills to ensure that your advocacy messages are well amplified. Also, once the issue relates to health, or any other thing, would be tobacco or health, youth voice serves as, uh, an awakening, more or less, to the politicians, because we all know, I mean, especially in Africa, where we have a large youth population, and once the youth make a case, the politicians are more attentive because they are able to, of course, determine sometimes the discussions within the public space, because of their influence, either in the media or in the society, how active they are. And so that's how we use the youth. But we're careful to make sure that we're building their capacity so that they appreciate the difference between activism and advocacy, because of how vibrant the youth can be or are. You don't want to, of course, get them to turn into activists and, rather than advocates, and the
Right.
likelihood of rather creating a situation where the politician or the policy decision maker is rather pissed off by their actions. You want to rather have them as a good ally, where their actions are contributing
A
positively
welcome. Right.
and welcome to the advocacy that you want to, the change that you want.
Son?
Yep, of course. Actually, a very good question to bring youth in the budget.
If I can interrupt you really quickly,
sure.
CRBS isn't a very, people think of it as an administrative issue. It's not
Yeah.
considered the here and now, the immediacy of CRVS, civil
Yeah.
registration, is lost on a lot of
Yeah.
people.
Yeah.
I'm wondering how you sort of effectively engage with youth advocates on a topic that's quite, that people don't think of at first hand and don't think of it as a very, again, urgent subject matter.
Yeah. But basically, in our context, not far different because the COVS just treat as the administrative functions. When we talk to Ministry of Finance, Ministry of Interior, even we talk to the General Department of the Identification, they said that this is kind of just the administrative function that they do it. But from what we are doing at the first is we reframe the issue to linkage the issue with others, cross-cutting development issue. For instance, linkage between the COVS with the social service deliveries of the commune levels, and then linkage the COVS with the accurate population data for the communes to support the commune to develop their own commune development plan or something like that. So this is kind of the how we can try to reframe the issue and link the issue to another issue as well, especially related to the public population data, and also to ensure the effective service deliveries at the communes level, and also how the COS can contribute to the inclusive developments. So if you have no any citizen data, clear population, you don't know even how many disability people in your communes, how you develop your communes effectively. Even you don't know how many ethnic minority, how many indigenous people in your commune, in your community. So how you develop your own investment plan or your own investment program for development your own community. So that's why we try to reframe and also linkage the COVS work with another service delivery, and also how the COVS link very close to the inclusive developments. So that's why even we try to discuss with the Ministry of Interior, we still can play around how the COVS can support the planning process, how the COVS can support the effectiveness of the budget decisions, how the COVS can ensure your budgeting your budget are used addressed to the people need or something like that. So I think this is way
So
that
essentially speak to
try
their
to reframe.
concerns, speak to their specific, your constituent, which in this case is youth.
Yeah.
That's what they would speak to. Very targeted approach.
Yeah.
Thank you.
So
Thanks, Son.
that's why we also link with the youth. So from our experience, when we work with the youth, we some kind of build on their capacity, because in terms of the budget, literacy is very critical, and that we need to enable them to read the budget at the commune, to read the budget at the district, at their own commune, and then we support some kind of the youth participatory action research, and then we support to use their research to dialogue at the municipality level, at the commune level, at the provincial level, to present their result that they collect from their research, and present their recommendation for improving the effective expenditure at their commune as well. So that's why, to engage with the youth, there is also another specific scenario how we can attract their interest, right? Sometimes it's not only the training day time dialogue day, but they can interact in the social media, in their platform, and so on and so forth. So that's why I think this is also a very trick that we need to buy in youth commitment to be part of our advocacy as well.
Thank you.
We need to support them to have their capacity, and also need to support them to generate the evidence to support their advocacy works. Yeah.
Thanks, Ben. Appreciate it. I'm moving on to another question in the interest of time, and I'm hoping Aminu can address this one, because you mentioned health security, and you had some discussions about, essentially, with some of the points you mentioned were interesting. You have to convince the ministries of finance and health that this is in the interest of the country's economic security and health security. So following up on that particular point, there's a question from Denise Froman. How do you work around insufficient evidence to make your case for return on investment on a particular issue? So, for instance, if you find that you don't have enough evidence to provide that would essentially make that investment worthy of time and attention, how do you convince a policymaker it's still worthy, and what kind of evidence do you look for? I'm looking at Aminu. If you could take that first.
Okay, thank you very much for this question. Really, budget advocates everywhere, especially in the global south, we work in an environment where evidence is always scanty. The information is always scanty. And where the information is even available, it's always difficult to get from the government approved agencies. And this is one of the reasons why the previous question was also important, building the champions within the political space to help us navigate some of the challenges regarding insufficient evidence and information. So in a situation whereby we are engaging a minister of finance, or we are visiting the national security advisor in the country, or we are engaging with the Senate president and the parliamentarian, yes, evidence could be scanty, but we now work with our champions to engage these political actors. And we found that approach very useful, even in the midst of scanty information. They help us to, soften the ground, because champions, they're expected to be influential, and people with, high-level connection within the political and policy space. So we go together with them to ensure that when they knock at the door of any policymaker, the door opens automatically. So this is some of the approach we are using. And also, even with the scanty information, we continue to generate information. And one of the reasons why we attend those government mechanism meetings on a quarterly basis is in those meetings, we also get access to information that ordinarily will not get them anywhere. So this approach we use to ensure that we continue our budget advocacy despite the bottlenecks and the challenges in country. Thank you, and over.
Thanks, Aminu. Stephen, did you have anything to add to that?
Yes, I wanted to add what we do in cases where we do not have, of course, just having the data will not be always enough. We also use human interest stories. For instance, when we were advocating for increase in budgets for epidemic preparedness, in a meeting with members of parliament to make the case why government should establish a public health emergency fund. For instance, we went together with citizens. We met with some citizens who had human interest stories to share of how they have been affected by an outbreak, for instance, by COVID or by any other outbreak. And in the case of our immunization work, we also meet policy decision makers. Sometimes we bring mothers, queen mothers, who are traditional leaders and key influencers within the community, to present their human interest stories about how the lack of vaccines have affected their communities, how people have been affected by polio. And I think human interest stories touches the emotions of policymakers, because even without the data, they can relate to how people have suffered or have been affected or impacted negatively by the absence of an intervention because of the lack or low budgetary allocations. And that has worked well by helping to, of course, get the policy decision makers to act swiftly to our calls.
Sorry, trying to fumble with my mute button. I see Eliana has appeared. We're at time, so unfortunately, this is time to end this really wonderful discussion. Eliana, over to you.
Just want to say thank you to Veena for your wonderful facilitation, and also for these great speakers. I think it's really clear that in this changing landscape, civil society and advocates play such a critical role, and you've shared so many wonderful methodologies and tools and resources and examples of what works. And Really appreciate those. I hope, the audience can take that away and apply it to their own advocacy. So thank you everybody for joining, and we'll see you next time. Bye.
Thank you, everyone, and
Thank you
much
for having
pleasure to be part of the discussion.
Thank you, Eliana.